You just give it about 10 seconds. You will be live any second now. You're live, Councillor Locke.
Good evening, everyone. My name is Councillor Mary Locke, and I'm. This is my neighbourhood, sorry about this, my councillor forum, we've got. I've just remembered that we are recording, and this is going out on the will be on the council's on the council live. Excuse me, I've got my teeth in the wrong way round. Tonight we've got two guests, sorry. Dr. Justin Barney, he's the Director for Public Health, and he's going to give us some information on the pandemic COVID-19. Over to you, Justin.
Thanks, Councillor Locke, and hi to Stirchley. I'm going to talk a little bit about where we are in terms of COVID and the current situation. I'll touch a little bit on testing, a bit on the vaccine, and a bit on where we're going next. And if you want to put any questions into the chat box, then I'll try and pick them up as I go along. So in general, what we're seeing at the moment is that the number of cases in Birmingham is increasing with COVID-19. Our testing rates are staying pretty stable, which is great. We've seen a real increase in testing over August and September, which has really helped us stay on top of what's going on. But what we've seen is the percentage of those tests, sorry, is now increasing, and that's why our case numbers are rising. But they are rising at a much slower rate than some of the other areas in the country, and I think that's a reflection of all the hard work that people are putting in to keep that distance of 2 meters from people they don't live with, washing your hands regularly, not touching your face if you haven't washed your hands, and making sure that when you go into a building you don't live in, you're covering from your nose to under your chin with a face covering. And all of that is having an impact. Particularly, you can see since we introduced the restriction that stopped people going into houses they don't live in, that has played out, and our numbers have slowed down in terms of the increases that we're seeing. But the general direction of travel, I'm afraid, is still upwards, and that's why it's really important we all still stick to the regulations and really do our bit to try and control the spread of this disease. We sadly are seeing an increase in the number of cases in care homes now again, and we're also seeing a shift in terms of the age profile. So where back in August, where numbers started to rise initially, this was predominantly in our younger population. Actually, we started to see that flatten out now, and the numbers in students, for example, is starting to reduce. But we're seeing the numbers in our over 80 population really starting to go up, and that is of real concern. We're also seeing a shift in terms of the ethnicity of people that are testing positive, and we're seeing many more people from our white population now testing positive, and that does seem to be increasingly where the spread is happening, whereas a few weeks ago it was much more that the new cases were in our Asian community. So we're seeing that spread now, the pattern of spread changing, which is of concern. Overall, testing hasn't really changed hugely in the city. We obviously had the drop and collect programme, which we've paused at the moment while we do a bit of reflection, but that has actually helped us identify cases and outbreaks across the city and been really useful in increasing testing uptake. We have more walk-through centres opening. We have more walk-through testing sites than anywhere else in the country. So we currently have I think it's 8 sites that are operational, and there is a new site that's going live in Stirchley over the next week or so, and I'll probably pronounce it wrong, Councillor Locke, but I think it's, let me get this right, Lifford House on Ford House Lane. So that will be going live, I think, over the next week. They're just starting the build at the moment, so you'll see the tent go up and start the signs go up. Now, the important thing to stress about this site is It's a walkthrough site, so you've got to have an appointment booked through the NHS by ringing 119 or going on the website. The reason we say that is we don't want people queuing up outside. The queues are dangerous, frankly, whether it's queuing at the supermarket or queuing at the testing centre, because people aren't great at keeping that 2 meters of distance. So it's really important, only go if you've got an appointment. There isn't a problem in Birmingham at the moment getting appointments. If anything, we've got spare appointments there. So please do book an appointment. As I said, this will be the 9th site we go live with. There's been no evidence from the other sites of any risk to the local community. And these sites are only offered to people that live within a reasonable walking or cycling distance. So it's about 1.5 miles, just under 2 miles, that when you put in your postcode to book your test, if you live within that distance and you say, I haven't got a car, then you'll get offered this site. So it really is about providing testing for local people. So that, I hope, will really help you in Stirchley get even better access to testing than perhaps what you've had in the past. We're hoping to get another 4 or 5 sites. It's a bit of a negotiation at the moment. So we'll see, but I'm really pleased we were able to bring one to your ward, and I think it will really help you get access to testing as things go forward. So I'll just focus a little bit about risk reduction. So I'm often asked about, well, what can we do around people and reduce their risk of dying or getting seriously ill if they get COVID? And there are 6 things that increase your risk of being very unwell or dying. 3 of them you can't really change, and 3 of them you can. The 3 you can't change is if you're elderly, particularly if you're over 80, your chances of being very ill are much, much higher. If you're a man, you're more likely to be very sick. And if you're very overweight, and if you are from an ethnic community that's not white British, you are more likely to be sick and very sick or die. Now, the men and the ethnicity relates to the 3 things you can change. So first of all, if you're a smoker, it's a really good time to quit, because smoking definitely increases your chances of dying if you catch COVID. Second, if you're carrying that extra weight, most of us put on a bit of extra poundage during lockdown. Really important to try and help reduce that now. People who have a higher body mass index, who are fatter, have a higher risk. So anything that you can do to get more active and try to bring your weight down, that will help. And then the third is, if you've got a long-term condition like diabetes or high blood pressure, it's not just having it that increases your risk, but it's also how well you look after it. So if you've got your blood sugars are going all over the place as a diabetic, you're much more at risk than someone who's got their blood sugars under control. So those are 3 things that we can all do if we're affected by them. Is make sure you've given up smoking. Even switching to vaping is better than carrying on with the cigarettes. Ideally quit, but if you can switch to vaping, it's a step in the right direction. If you're carrying those extra pounds, get active every day and do what you can to help get your weight a bit more under control. And if you have got a long-term condition like diabetes or high blood pressure, talk to your doctor or your practice nurse. If you're struggling and you're really struggling on how to improve things, please reach out for help. Primary care is still open. So the final thing I'll just touch on is just to reiterate the testing point. If you've got symptoms of COVID, any of the 3 symptoms, a high temperature, a new continuous cough, or a loss of sense of smell or taste, ring 119 or go on the NHS website to book a test. Only book a test if you've got symptoms or if you've been asked by a public health doctor to get a test. So if one of my team ring you from the council and say, we're from public health, we'd like you to get a test, you can go on the website and there's a box you tick, and that's okay. If we come to your door and offer you a test from the council, and it would only be someone who's got a council uniform on or the high vis vest type things, then that's okay. But in general, only get a test if you've got symptoms. It doesn't make any difference to how long you have to isolate for if you're isolating because someone else in your house has COVID. So I'll move on to talk about that isolation before I go to vaccination, because people do get a bit confused. So from the day you have symptoms, you should start isolating, and everyone in your house should isolate with you. That means no going to the shops, not taking the kids to school. It means not leaving the house, preferably. Then you should order a test. You should stay isolating until you get the results of that test. If that test is negative, you can go out and get on with your business. That's fine. If that test is positive, you need to isolate for 10 days from when your symptoms started, and everyone you live with isolates for 14 days from when your symptoms started. Doesn't matter, they should only get a test if they get symptoms, because it doesn't make any difference to the 14 days. If they test negative on day 10, they've still got to stay in for another 4 days. And that's because the way the virus spreads, they could have caught it from you on day 8, and it just won't be in the back of their nose or the back of their throat yet. They won't have the symptoms yet. So you're testing too early. So 14 days if you live with someone who's got symptoms, 10 days if you're someone who has symptoms. The final thing I'll pick up before I answer any other questions you have is about vaccine. So there are lots and lots of trials going on around the vaccine at the moment. The government has backed several different types of vaccine. They basically backed lots of different horses. We don't know which one's going to work. The NHS have been asked to work out how would they distribute the vaccine, and what would they do if it was a single dose, or if it was 2 doses, or if it was 2 doses far apart, and what difference would it make if the vaccine needs to be kept in a fridge. So you will have seen in the media some stuff about this where everyone got very excited. The vaccine's not ready yet. I don't expect it to be ready until the end of the year. And then once it is ready, there'll be a process by which people are prioritised. And as you would expect, we need to give the vaccine to NHS frontline staff first, working in our hospitals, because they are the most likely to be exposed. Then I expect there'll be a prioritisation around people who are most at risk of dying, and that will be similar to seasonal flu jabs. Then there'll be everyone else. But we will be in this for at least another 4 to 5 months, because vaccination at that scale takes quite a long time. But I would say I'm much more positive than I was a few months ago about the vaccine trials. It looks really positive. It's just not going to happen quickly. So great to see a comment from someone in the chat box about how they took their daughter for a test at one of the walkthrough sites and actually found it really easy to book and use, and that's really positive. I think the vast majority of people are actually finding those sites really helpful. And although at the walkthrough sites, someone doesn't do the test for you, but they do kind of stand on the other side of the room and talk you through it. So there's someone to help if you do find it difficult, which I think is really, really helpful. You also tend to get a slightly faster result than the postal kits if you do it through the walkthrough site. So that's a bit of a secret tip from me on the testing. Finally, in terms of where we're going next, as I said at the beginning, I think we are climbing ever higher. We are taking our time. It's really clear Birmingham is kind of taking each step slowly in the increasing case numbers, whereas Manchester and Liverpool just ran straight past us, you know, and sprinted up the stairs. We're taking our sweet time to do it slowly, and I think that's good. I think it helps our NHS prepare. I think it will save lives, and I think it is a reflection of all the hard work that you and other citizens, businesses, the council, the NHS are doing to follow the rules and help manage this outbreak. At some point, I expect we will go into higher levels of restriction, but it won't be tomorrow, and I doubt it'll be next week. It's a little way off yet. There is a lot of discussion about a circuit breaker, and I think it's important to stress that what a circuit breaker does is it pauses things probably for about a month if it's going to be effective. I don't think 2 weeks is long enough. And then you kind of restart. So the aim of circuit breaker is to take us back to where we were in July, the beginning of August. And then we just start to climb again. And the aim is to try and help the NHS manage. So, you know, I think government's got a really tough decision about whether they do or don't do a circuit breaker. You know, obviously massive impacts for industry and jobs to close everything down, because it would be like we were back in April and May. Everything shut, everyone stay home. So that's why there's not a kind of mad rush to do this. It's not something to do lightly, and all it does is slow down the rate of increase. It doesn't stop things, unfortunately. That's why everyone's paying attention to the vaccine, which I think I would say I think it is a lot more hopeful, and I am a lot more positive about it than I was a couple of months ago, that we may well see something early next year coming out. And that will allow us all to live a little bit more easy. But in the meantime, really important, wash your hands, keep that 2 meters distance from anyone you don't live with, wear a face covering for your nose that covers to the bottom of your chin if you're going into a house that you don't live in, or any building you don't live in, or into a taxi or in a bus. And my other top tip is don't touch your face until you've washed your hands. Because that's how the virus gets into our body. It doesn't burrow through our skin, it crawls in through our eyes, our nose and our mouth. So if you can keep it away from your face, you'll keep yourself, your family and our community and our city safer. So I hope that's been okay, Councillor Locke. I've tried to cover as much as I can, but happy to take any more questions you'd like to raise.
Okay, thank you very much, Justine. Are there any questions that people want to ask? Put them in the chat bar on the right hand side of the screen.
Councillor Locke, there is just one extra one that's just popped in, if Justin can answer that one.
Yeah.
So that's a question from Sandra. It says, what should you do if you're contacted by a restaurant and told someone else has tested positive? Should you self-isolate even though test and trace hasn't come to you or your team? So it depends a bit, Sandra. If you went to if you worked in the restaurant, then your boss should be telling you whether you need to isolate or not. And it will depend on whether you have had exposure. If you were someone that went to the restaurant to eat and you weren't sharing the table with anyone else who was tested positive, then I would say the risk is probably pretty low. But I think what restaurants are doing is, if they're aware of a case and they know anyone else that was in the restaurant that night, they're doing what's called inform and warn. So they're letting you know to be alert. You don't need to isolate. But if you did develop symptoms, then when you talk to Test and Trace, it's really important you mention that you went to this restaurant, because it might be that you went to the toilet and the person before you didn't wash their hands properly, didn't wipe down the door handle or the taps, and you touched it and got contaminated, for example. So it's really more that inform and warn, so that if you do develop symptoms, when you talk to Test and Trace, you go, oh, actually, I remember the restaurant told me I must mention that, because that's the really important bit of the connecting the dots that we need everyone's help with to try and control the spread of this virus.
When can I have more information for when Lifford House is ready to go? So, because I was the first to know today, so it's useful to remind people to book an appointment first, because that's important. I know sometimes, I don't know whether any of the businesses are here in Stirchley. It's an awkward time because sometimes they are, quite a number of bars and restaurants. It's awkward sometimes to police them. I know, telling people, we know you're not from the same family and you can't eat together. It's taking a risk because some of them are small businesses and we haven't got the police numbers for every business, because that can be tricky as well.
Yeah, so we'll definitely, once we're definite that Lifford is going to open, we'll get you the information, because it's in the building stage, and this is one of the bits that we're a bit cautious about. Do we tell you it's going or not? Because until they actually start tomorrow, they can always throw a spanner in the works.
Yeah.
So but we'll definitely, and I've had a chat with the team to make sure that comes through. In terms of businesses, and I was just actually on a call with businesses across the city, and we discussed this particularly. So my advice is Make sure you've got clear signs up in the window. Please wear a face covering if you're coming in. Remind people, have that really visual sign, and people will think twice. If people do come in and they haven't got a face covering, then it's perfectly reasonable to say, have you got an exemption? There is a free badge that people can download from the Department of Health website that you can download on your phone, or you can print it off. I've seen people on the bus, they put it in a little lanyard around the neck, and it's fine. I mean, that's a good way of showing it. And people who are exempt, there are good reasons why people are exempt, and it's a bit like having a blue badge for your car, frankly. If you're entitled to it, download it, put it out in the public domain, and it just stops people asking you questions. Ultimately, each business has to make a decision on the basis of risk about how they manage people that aren't doing what they should. And it is difficult because we know businesses are really strapped at the moment, and the trade-off with, you don't want to be known as the grumpy soup man that was back on TV years ago, or the grumpy business owner who's always challenging people. But you also have to recognise that if we find outbreaks that lead back to a particular business sector, it is much more likely when we go into tier 3 that there'll be restrictions for that business sector. So it will only take 2 or 3 outbreaks that are clearly associated with restaurants for all restaurants to be closed. And that's where, it's really important businesses do play their part and say to people, if you're lucky enough to have outdoor space in your restaurant, and I know Stirchley, having been through a few times, many of your restaurants don't have that luxury. But if you do have outdoor space, people can sit on a shared table outdoors, because that's considered outdoors rule of 6. So if you can say to that someone, you've got that opportunity, guys, we can move you to a table outdoors and you'll be safer. It'll be a bit cold, but it's safer. But it is important. I think we all play our part. Certainly I've found over the last week where I've booked a restaurant, they've emailed me before and said, thank you for your booking. Just to remind you, here's the guidance. We rely on you to do your part as customers to keep us safe. So it's a bit about pushing this back and saying it's all of our responsibility. Yes, businesses have got to play their part, but actually it's to us as citizens of Birmingham what we choose to do every day that will either mean we'll be in much tighter restrictions because we can't control this virus, or together we will actually keep this under control and save lives. And I'll just remind people, today over 1,400 people have died of COVID in this city. Now in the Blitz, I think we lost just under 2,000. So we're heading in the wrong direction. And I really don't want to see that as the legacy of this, that COVID cost this city more people than the Blitz. It was bad enough we lost people then. I don't think any of us want to see that number dying again. So that's the responsibility we take every day in the actions we choose to do when we walk out our front door. And it's a heavy responsibility, but it is something that's important to all of us because it's our loved ones that are dying. It's our loved ones that end up in hospital. It's our friends, our family, our community that are affected. So it's our decision to make and take control of this.
I think that you've said it, but I know a lot of the businesses here in Stirchley, they have, some of them have got outdoor space, and you're welcome to come and anytime anyway. I know that because we have some very good businesses, and they have been through some difficult times, as all businesses have across the city. But thank you very much. Are there any more questions? Because it's not just me asking questions, it's got to be the residents of Stirchley and the community. Is there any more, Kay?
There's just one, Councillor Locke, asking, is a shed with an open side counted as outside?
Yeah, so it needs more than one open side. So my kind of, and this is my rule of thumb, so this is Justin's rule of thumb rather than this is kind of the letter of the guidance. basically what you're looking for is that you've got to have air flowing through. So think of anything that's outdoors more like a gazebo. So it's got a roof but no sides, or it could have one or two sides, but two sides have got to be empty, because the air's got to be able to flow through. And it's that air flowing through that disrupts the spread of the virus. So if you want to do it with a shed, you need to take both sides off, I'm afraid, and they need to be both the long sides rather than both the short sides, because that's the most sensible way to approach this. Rule of thumb: if you can't see through it, don't go in it.
Okay, well, thank you very much. Any more? I don't
No,
think
I think that's it, Councillor. I think that's all of them.
Well, thank you very much, Justin, and just keep up working. I know the team, and there's many people across the council working very hard on this, and thank you very much.
Thank you for your time, and in better times I'll be definitely down to test out Stirchley's culinary offerings.
And drinking as well.
I'll hold you to that on the other side.
Oh, all right then. We'll see you in the spring. I hope before then. Right. Well, thank you very much to Dr. Justin Varney. Our next guest is Sue Amy, who is head of parks. And I'd asked Sue to come today because I thought it would be interesting for her to give us some feedback on how she's been coping during COVID and everything, because it's been tricky for everyone. But some of the news about Hazewell Park and the BMX track. So over to you, Sue.
Okay. Just to confirm, I'm Sue Amy. I'm the district parks manager, and I cover the whole of the south. So that's Northfield, Edgbaston, and Selly Oak districts. It's been quite a challenging time for the park service over COVID in terms of operationally making sure that we can carry on cutting the grass, doing all the litter picking, playground checks, etc., etc. You'll have seen playgrounds closed at the height of the crisis, and then once the measures were reduced somewhat, we were able to open them back up. We are still operating at a reduced level, so we have been in catch-up mode for quite some time, most of the season so far. However, we are now on top of the grass cutting itself, and we're in the final cuts across the board in this month. So if you've seen your area being cut in the last few weeks, that's the last cut it's going to get now until next spring. We are at reduced operations. This is because of the difficulty that we have implementing COVID regulations in our depots, where we've got a lot of staff, but we've got very limited welfare facilities, and it's proving very problematic to be able to set them up in a way where we can do a full day. So we've tried to prioritise the most important grounds maintenance tasks like grass cutting, hedge works and things like that, and things litter picking, dealing with fly tip, etc. And the areas where we have been struggling to keep on top of are things like what we call follow-up, which is where we have our strimmers who go around after the mowers have been round and pick up long bits of grass and weeds around obstacles like lamp columns, seats and benches and stuff like that. In the main, though, we've pretty much got back on track with the standard programme. And if there are any issues with people thinking we've missed anywhere, then they can be reported on the self-service site, and we'll investigate those as we go along. We've had a phenomenal amount of tree inquiries. Our tree officers have seen a fourfold increase in tree inquiries. Part of that is due to the very windy weather that we've had this year, especially with the couple of storms that came over. But also we do seem to be getting a lot of inquiries anyway, probably because a lot of people are at home They're using their gardens a lot more, and so they're noticing issues with trees that they are worried about, so they're getting in touch. It just means that across the service, we are a very small service considering the amount that we actually have to get done, and it's just meant that for quite a few of the inquiries we may be taking longer to get through and get responses to people. And what we'd say is just please bear with us, because we are a small service and we're getting a lot of inquiries and we're just trying to work through them. There's some really positive things that have been happening, especially in the wards. I had a meeting last week with the new Friends of 10 Acres, who have been working really hard out at that site, which is at the rear end of Hazelwell Park. So you access it off Cartland Road, just down by the pedestrian crossing. They've been working and engaging with local people, local users, people who are drug users as well, and trying to proactively engage with them to try and promote positive behaviour and positive use of that site. And they've cleared absolutely vast amounts of bramble along the side of the path. And we're going to try and do some extra work for them to try and open that path up, so we can get it to dry out. And then the plan is that we'll work together next year to see whether or not we can get some funding in to improve the path so that it stands up a bit better. But I was so impressed with the amount of work that they've done over the last couple of months. They've really made a massive difference out there. We've got the BMX track at Hazelwell. We've had a few issues there, but I think over the course of the earlier months in the summer, we've met with the community, we've carried out some work there, and what we've put back now seems to be a sort of happy medium. I know that there's been a little bit of titivation by some locals, but nothing to the level that happened over the summer. What I'd be saying to people is we're still keen to work with the community group, so get in touch, and we would need to work together to target funding, because the City Council has very limited options where it comes to funding for these sorts of things, but we're happy to work in partnership. Just really need to communicate and people come and talk to us. We've also been approached by a resident who's very keen to develop a pump track, which is, you might think that BMX and pump track are the same things. I know I did originally, but they are subtly different. And we're just waiting to hear back on their proposals. And what I've said to them is they need to start doing some consultation locally with everybody who's out there, to see what the feeling is about their proposal, and where they'd like to site it. Any of these sorts of proposals, I just need to flag, the City Council, as things stand, doesn't have any funding to either pay for these facilities to go in or to pay for the upkeep of them afterwards, which can mount up. So any initiatives, really, we're looking at working in partnership, and they need to be self-funding, funded externally, and the ongoing revenue costs would also need to be covered in some way. But there are ways and means of doing these things. Friends of Cotteridge Park have achieved a huge amount on their own with support from us, but not financial support from us. And they're a really good exemplar in how you can get funding in as a group, and get stuff done in your local park. The other thing we were talking about, we've got a question regarding Stirchley Park, and a question about Stirchley Baths, it being open, etc. I don't actually run Stirchley Baths. I know that Karen's here, so she may be able to answer that question. But it was just to give you some examples where we are in parks, where we are struggling to get all our facilities open, is with our visitor centres at our major sites like Lickey Hills, Sutton Park, etc. We currently still have those facilities closed to the public because we don't have the resources to be able to open them up and provide sufficient COVID responses to make sure that they're COVID safe. for members of the public. So at present, those are staying closed. The facility at Cotteridge Park, a lot of you, I'm sure you've been out there or you've seen the information about what they're calling the shed, which is a fantastic facility. That facility has been completely put in, researched, funded, and is being run entirely by volunteers. And they have also had to put in place very strict COVID measures to make sure that they are able to open to the public, and they're only able to open once they've got those measures in place. But it was just to say that, you know, that facility is a great facility, but it did require a huge amount of input and effort from the Friends, and as a Friends group they've been up and running for over 20 years, so they are able to draw on a huge resource of knowledge and experience. But they are a great exemplar of what I said to learn from. So if people have aspirations about working with us, working with a Friends group so that they can get new facilities in their local piece of public open space, there are examples out there which we can learn from, and we can, you know, work together to try and achieve that. I would leave it there unless there's any other questions, but feel free to email me if anybody's got any specific ideas, or if you've got a part like Stirchley Park where you have an active Friends group, obviously they can be contacted with your ideas, and it's something that we can then discuss together and see whether or not there's any opportunities that we can take advantage of. Just going to have a look at the questions. So we got one about avoid the use of weed killer and leave more areas wild. Oh right, and this is about the Hunts Road. Well, the Hunts Road, basically we try to avoid using weed killer except in areas where it's essential. And when I say essential, that is things like where it could become a bit of an issue for health and safety reasons. So, for example, where we have a trip rail, what we call trip rail, is the low metal or wooden fencing that you see around parks. We do keep those on a spraying regime because we need to keep them visible so that they don't become a trip hazard. It's a bit ironic them being called a trip rail, really. We don't want them to be a trip hazard. We want them to keep people out that we don't want in our sites. We also, there's a spraying is carried out for that type of operation, whereas historically it would have been done by operatives using strimmers. It's very important that we try and minimise the use of equipment like strimmers, because they are quite problematic in causing repetitive strain injuries and vibration injuries, because if you can imagine, if you're using that and you're strimming most of the day, 5 days a week, it would have quite an impact. So as a health and safety measure, we're reducing the amount of strimming that we do to protect people from getting these ailments. And that's why you will see trip rail and things like that put on a spraying regime. We have got an awful lot of land where we haven't left it to grow natural, and we've got areas that are left purely as what we call rank grassland, so they're completely left to regenerate. We've also got areas where we have wildflowers, which we do a cut and collect each year. It's also quite important to make sure that where those areas are, that they don't cause issues with sight lines, and so that it's the right thing in the right place. So we're quite up for having more unmown grasslands, but it's just making a decision about that it's in the right place that's appropriate and doesn't cause any negative impact. On the Hunts Road, that area there is just supposed to be trimmed off once a year. It should have been done by now. It would normally be done late August, early September. So I'll just, have we got any, is there any other?
No, I think that's
it. Is that it? Okay. But I mean, I'm emailable. You can either contact me through the birmingham.gov.uk website to do an online inquiry, or you can email me direct. I'm easily findable.
Thank you for that, Sue. Thank you very much, Sue.
That's all right.
And I think also must mention over by Dad's Lane, by the chip shop.
Oh yes.
By the Boar as well. I think that finally we got that, well, through persuasion and everything, we got that looking quite nice. And it's one of the residents came to meet us, and it's going to be kept nice as well.
Yeah, I mean, that was a shame. It was the Environment Agency scheme where they had it all inspected, and unfortunately the work slightly failed the inspection, so they had to come back and do some remedial work. And it, I mean, all thanks to the residents for putting up with even more disruption. But that's now been fully completed. Fingers crossed it will have to be inspected again, and let's hope that it passes this time. But yeah, now, and so that's now been handed back over to us, and we'll be on the main mowing regime, which will start next year.
Oh, right. Is it over to me? There's another question for you, Sue. Or
Stirchley bloomers.
Yeah, it's one of the.
Yeah. Well, yeah. Well, there is. What I would say is there is a friends group for Hazelwell Park. Normally, the rangers would be working closely with volunteers. At the moment, we're still not allowed to work with volunteers. It's just it's getting the appropriate measures in place. We are working on that at the moment, so we would like to going forward be bringing back more of our work days with volunteers. There's no reason why. I mean, let's be positive. Next year, hopefully those things will all be back in place. So we'll let it grow back up, and then next year there would be no reason why that area there couldn't be cut down as part of a little practical session with some volunteers and the rangers.
Well, maybe sort of give it till the spring and see how it is, and you know, Kerry couldn't, because Kerry's asked the question, Kerry could get in touch with me.
Yeah.
And Kerry's got your details as well.
Yeah.
So we can look at doing that. Also, it's come on about Stirchley Baths. It's open for regular user groups that meet current national and local COVID restrictions and choose to restart. Unfortunately, at the moment, it has to be closed door service rather than general public access at Stirchley Baths. So maybe in the fullness of time, we'll see how things will be with the baths then, because I know a lot of us miss it. Are there any more? Oh, there's another one as well. Also, Karen says they did consider takeaway tea at the start, and takeaway tea and coffee service one day a week, but it became logistically too difficult to operate. So maybe in the spring or in the summer we can have socially distanced tables and afternoon tea. Do something like that. So thanks very much, Sue, and Karen as well. Good double effort there. And I think we'll go on. The next topic is about the ward plan. What Kay's going to do, she's going to send a copy out of the ward plan and ask people to think about ideas of for the ward, what they would like to do. That's true, isn't it, Kay?
Yes, Councillor Locke, if you'd like me to send it out, I can certainly do that.
Yeah. Do you want to send it out to all the people on your contact list?
Yep, that's it. I'll do that for you. Not a problem.
Also, has anyone got any questions or any suggestions now that we could sort of put in the box for consideration for the ward plan, because we haven't looked at it for some time about future aspirations for the ward and what we've been doing. No, I don't think so. Everyone's gone quiet.
I'm not sure whether Karen wants to say something about the ward plan.
Okay.
I can try and attach the current ward priorities, because I think that's the bit that people really need to concentrate on. If I see if I can do it, I will. Just bear with me. Has that come up?
Yes, it has.
Fabulous. My goodness, I am learning on this stuff. So this is what's currently in as your ward priorities. Obviously, it's 2018 to 22. It's obviously a changing document. So there are a couple of things that probably need to do is one, revisit the current priorities and put any updates and progress, because I know there has been. So so priority 1 was this ward-wide one, that everyone within the new ward boundary of Stirchley feels included and has an opportunity to get involved. So the 2 actions on that were the ones that are there, sort of micro neighbourhood residents meetings held on a regular basis, rotating ward forum meetings. Obviously this was all written pre-COVID, but there are some updates that could be put in there, because before the lockdown certainly some work was being done. On priority 2, the ward-wide, it was building up the already proactive volunteering and active citizenship within the ward, grow a sense of inclusivity, social cohesion and neighbourliness across the ward, have a specific emphasis on young people provision and opportunities. So there are 2 actions that were written in there. First of all, I've put in red just so you can see what sort of an update could be. So on the one on working towards being the first formally recognised dementia-friendly community in Birmingham as part of the Selly Neighbourhood Network scheme, you'll see it's written out. And then as an update, awarded, it was successful. It was awarded in December 2019, and that to enable the longevity and continue the work and for it to be embedded locally, support work has now been handed over to Leaf Creative Arts to continue through a grant from NNS. Obviously that's been a bit halted because of COVID, but that was there. Priority 3, ward-wide, a clean and green ward. You can see them on the screen, so I won't read them all out, but some of the boxes still need to be filled in, and also an update. On priority 4 was around Pineapple Estate, the revitalisation of Dad's Lane Community Association and community influence on Camp Hill Railway Line. So we know that the work has progressed on Dad's Lane. It just needs a bit of an update in there. And obviously the one around Camp Hill Lane, certainly the first virtual or second virtual ward forum meeting was given over to that. So that's ongoing on there.
And the next ward meet forum is going to be on the Camp Hill Line.
Yeah. Priority 5 was around the Cotteridge end of the ward, ensuring that this new part of the ward is included and networked into any new developments. So there's a couple of things there, probably some others. So I know that the neighbourhood forum has expanded its area to include all of the Stirchley ward, so there might be other things that can go in there. And priority 6 was the central Stirchley, including the High Street, ensuring meaningful engagement with Southern Capital development and developing a positive image for the High Street retail. So some of the actions there were around the Future High Street Fund. So we know that there is some update and some progress on from when this was first written. So those need to be completed. But it may well be, because time has passed on, that some of these priorities need to be revisited, and there may be others that need to be prioritised. Obviously, with COVID has had an enormous impact, so there may be, we're recommending through the NDSU that perhaps a COVID recovery transition type of priority might also want to be added into all of ward plans. And obviously the important reason why this is done and is as full as possible is so that it can influence any funding that is going to be made available to wards, particularly through the sort of working locally priority. So, and ones that meet cabinet portfolios, there is a little bit of money that's been put aside where ward priorities can match cabinet members, and there are some funds that can come through on that. So that's the current priority list. There may be some changes on the general ward plan, but that is more of a background to the area, the demography, etc. Some of that may need a bit of updating, but probably not as much as the ward plan. Now I've got to see if I can take it off again. Hold on.
Thank you, Karen.
Has that now disappeared?
Yes, it has.
Right. There
Well,
you go.
thank you for that. I don't know what people think. I mean, I know the things mentioned into Severn Capital, they are, I always think the Pershore Road part is still Severn Capital. The Hunts Road and behind is now Taylor Wimpey, because that's changed, and having liaison with them. So I'd like to get, you know, I've spoken to them on the phone, but it'd be nice to get, you know, community involvement with them as well. Dad's Lane I'm in correspondence with, and they're literally knocking the house apart now, and it's literally knocking it down. But you know, because it does cover a wide area, so you know, I'll have a look at it myself, and also if people want to have a look and come up with some suggestions as well for a way, you know, for a way forward, you know, for the future, especially thinking of, you know, all ages within the ward, and you know, we are a dementia friendly ward, and also for young people, we've got to include them. I think that's a good idea regarding, you know, post-COVID and what can happen and what we can be doing, and looking at what sort of things we can plan. But I don't know whether anyone has got any questions. I can't see any. Is there anything?
No new questions, Councillor Locke.
Everyone's very, very quiet. Do I take it that, well, I thank you all for coming. The next meeting I'm having is in January. I'm going to do an update again about the Hazelwell line. Now that all the plans have been passed for the Hazelwell line, Kings Heath and Moseley, there may be some further information on you know, when the work will start, and also information for people who live around Parkland Road, Pineapple Road, especially the issue of parking. But if the you know, the details can go out to everyone and send their comments and thoughts in for the future, for the ward plan, I'd be grateful, and I'd like to thank you all for tuning in. It's very, it seems very strange talking to yourself, I want you to stay safe. Please come and say a socially distanced hello if you see me on the high street or wherever, and take care. All the best.